All right, of course, we are here tonight to practice more questions. And so I think we will put our 2 minutes on the clock, and your time starts now. All right, so look, not an uncommon presentation. It's something that I think we've seen dozens of times in clinical practice. The question is, are you following the evidence-based guidelines? So this is a sneaky way to start to assess some of your knowledge around these common presentations that perhaps we've worked out our own ways to handle, but we need to fall back to what is best available practice. So here, in terms of lifestyle habits or behaviours that could exacerbate persisting fatigue, and particularly a young case like this, would be things like poor sleep hygiene. The common things are common, and we know that without good sleep, you're going to experience persisting fatigue. Unhealthy diet, and some of this may tie into socioeconomic status. We tend to presume that university students are probably living on the tighter budget, and so may not have access to fresh fruit and vegetables, or at least in quantities or supplies that would constitute an otherwise normal healthy diet. One thing students do have access to, he says from personal experience, is excessive caffeine intake, and I used to live off coffee. I still do, admittedly, but we know the people that have a higher end caffeine intake are more likely to have not only poor sleep but also increased fatigue. A lack of physical activity. The less active you are, the more likely you are to feel fatigued. Overcommitment. Now, they have mentioned here that she admits to having a hectic schedule due to university, but claims that her fatigue isn't solely due to academic stress. And so this would be something that would exacerbate. It may not be the sole cause, but I think would still be definitely counted as a potential answer in this matrix. Now, they haven't specifically said that there isn't other substances there, and so substance abuse being a valid answer, and I probably would go with an example in this category. So we have already highlighted here 4 to 6 drinks of alcohol on weekends is on the excessive side, and certainly can contribute to persisting fatigue. And there could be other substances involved. Lack of social supports. I think this would be a potentially risky answer, as there's nothing really to say one way or another, but probably more so that this question specifically asking, and here we go, what lifestyle habits or behaviours might exacerbate. And I think you'd probably be a bit stretched to try and say social supports is a habit or behaviour. And of course, high stress lifestyle can certainly contribute to fatigue. For these kinds of questions, fall back to, what would you do? What would you say to the patient that's actually in front of you? What would be the things that you'd be exploring to try and work out what could be contributing to this fatigue? And I think as long as you're in that kind of pathway and on that train of thought, you're going to set yourself up for success. But of course, we have more questions. So, with 2 minutes on the clock, Your time starts now. All right, so we have explored the lifestyle factors. We need to now think of what are the underlying medical conditions that we need to be worried about in the general practice setting. Lots to choose from. Now, these are taken from the RCPA recommendations and guidelines for investigations for fatigue. And so the things we want to be looking at here would be any kind of malignancy. I think if you give any kind of sensible answer on that kind of frame, you're going to be getting marks. Cardiac arrhythmia, or a suitable example, would also definitely be worth marks there. As well as any serious viral infections. So in this bracket in particular, you'd be looking at things like hepatitis C, HIV, or you could potentially put in something like Epstein-Barr virus or cytomegalovirus as well. I think anything that you're putting into that kind of bracket, I think is going to get you marks. Pregnancy. We have a young female of reproductive age, and it's not specified otherwise that she's not sexually active, and so it would be something you would want to confirm or refute. And then we can get into the kind of other common things that we need to be looking into. So psychological causes, stress, anxiety, depression, or any kind of suitable example there. Now, you can have, and this is probably more where EBV and CMV would come into play, a persisting mild viral or post-viral infection with suitable example would also be getting you mark. We've already talked about impaired sleep, and so sleep-related disorders, or a suitable example, obstructive sleep apnea, narcolepsy, any kind of appropriate thing in here would get you marks. Cardiomyopathy, so starting to explore some of the more weird and wonderful things would certainly play in. And anemia as well. I'm always a bit hesitant to just write anemia, but it is a common cause and would be something that would be readily investigated. Now, I've kept this broad here, but again, in the actual exam, I'd be listing a specific example here. So iron deficiency anemia, for example, I think would get you more marks or be more appropriate than just a blanket anemia term. Hemochromatosis with excessive iron load can often present with fatigue, and you'd be exploring again other things associated with that. Bacterial infections, celiac disease or Crohn's disease, so inflammatory bowel disorders. There's nothing really here to kind of focus in on that, but would be something that you could consider in this age bracket. Renal failure would be rare but not impossible. And of course, any suitable metabolic disturbance, and so things again like diabetes would be more appropriate. In this case as well, being more specific, I'd be specifying type 1 diabetes, for example, rather than just diabetes on its own. All right, hopefully you've got some answers in there. But of course, we have more questions. So let's get 2 minutes on the clock, and your time starts now. All right, come on, guys. You all knew it was going here. You knew I'd ask what investigations would we do. And so here we've got, again, this is coming from the RCPA website in terms of their recommendations, as well as there was a common sense pathology paper put through from RCPA through to Australian Doctor with some RACGP input as well. And essentially, full blood count, liver function tests, TSH, renal function as well, and electrolytes are the basic recommendations to start off with. There is a bit of a push that if there's any concerns around sleep disorder to actually put through for polysomnography, but this question, if you read the question, is what initial investigations would you consider? And so these would be from this list, the 3 most appropriate ones. Now, I think the FBE in particular is going to get you 2 marks there because it's going to be best bang for buck to look into things like anemia as well as immune function to give you an idea, could there be some kind of infectious pathology occurring there as well.